Okay, ladies, we're going to show you a few different exercises that you should add into your day. And I'm going to start with kind of the core Tupler exercise, which is actually kind of hard to show, but I'm going to try. So you can do this anywhere. I'm just doing it on this stool. I could have sat on my birth ball, but you can do it while you're nursing your baby, while you're driving your car, while you're in your kitchen cooking. It doesn't matter. Where you are, you can do this. So I would recommend that if you've got a diastasis, you wear a splint. I've got my splint on now. I find it easier to wear now than initially postpartum because you feel like really fat and you feel like it exacerbates the fact that you're really fat when you're early postpartum. And I can't do it then for that reason. But once I feel like I've lost a little bit of baby weight, I can wear it. So I'm wearing it now. Which is why you see kind of weird pokes. And I'll even show it to you. So you just splint around the midsection, and I definitely recommend her newer splint. I do think the splinting makes a difference, not just because it trims up the tummy while you're wearing it, but because it actually helps the muscles stay together and heal. But the core Tupler exercise, this is the one I'm going to show you. This is the one that I think helps the most, but she's got an entire series, and I did use the entire series to heal my diastasis and to keep it pretty closed from my 5th to my 6th and through my 6th pregnancy. I was a bit lax on it through my 7th pregnancy, and so now I've got to do some makeup work. I had like a 4-finger diastasis after my 5th, and now it's like at a 2, so I had it closed completely and then it opened back up, but it's not as bad, but I want to get it closed up again. So anyways, with the Tupler exercise, a lot of it is visualization in your mind. So you've got 2 points. You've got your belly button, and then you've got your spine. And so what you want to do is you want to pull your belly button back towards your spine. So you're squeezing your muscles together and pulling them back towards the spine. And at first, you may only be able to go in a little ways. And the way that Julie Tupler explains this is she calls it the elevator. So here, you know, your elevator's at the top, and then here is the 5th floor right on your spine. And actually a little bit past your spine is the 6th floor. So you pull it in a little bit, you get to the 1st floor, a little bit more, the 2nd, the 3rd, you pull it in really tight, you're all the way back to the 5th floor, and then she likes for you to imagine that you can pull it even farther back to the 6th floor. So you pull and you hold, and then you release. And depending on where you are in the series is how far you release. So at first you might be able to pull back just to the 2nd floor and release, and back to the 2nd floor and release. And again, it's a very subtle movement. And then as you get further progressed, you might go to the 5th floor, squeeze to the 6th, and release only to the 4th. So you're holding some tension there. And you do these in sets of 100. So it's like, that's why nursing a baby is a good time to do it. And it sounds overwhelming, and it will actually make your belly ache at first if you haven't done it. But you quickly grow used to it. You quickly redevelop functional strength. And it actually goes pretty quickly. Like during a nursing session, you can easily pop out, 100 little squeezes. So that's the Tupler technique. It's safe to do during pregnancy, like even all the way up through pregnancy. It's safe to do as soon as you feel like starting it postpartum. And I really think that it helps a lot with the pelvic issues going on. So I would definitely make this part of your daily routine. And then if you've got a big diastasis, you can look into the full program. Julie's is what I've used, so it's what I recommend. But Fit2B, Moo2, there's a lot of other programs. You can find the one that works for you.